In this episode of Ask the Doc, I got a great question from someone on Instagram that's been dealing with chronically tight hamstrings that really never seem to loosen up even when they spend a lot of time stretching. What's up, everybody? Dr. 𝐀𝐬𝐤 here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. Back at it for Ask the Doc. I'm going to read the full question. I got a great question from Mel on Instagram. She said, I spend at least 45 minutes throughout the day stretching out my hamstrings because they are always so tight. When I stretch them, they feel loose for about 30 minutes or so, then tighten back up. I would figure at this point in my commitment every day to stretching that something good would be happening, but it never seems to last. Why are my hamstrings so tight regardless of how much I stretch them? Thanks for sending that question in, and I hear stories like this a lot, where people just default to the idea if something's tight, then you must stretch it. And that doesn't get us to where we need to be. The key question you always want to be able to figure out is, why are those hamstrings tight? And a lot of times they're tight because they're trying to protect something deeper. A lot of times a nerve gets stuck. There might be some problems in the low back. And tight doesn't always mean that you need to stretch. And people that are giving that, just nonsense generic advice, well, your hamstrings are tight, just stretch more. I just need to stretch more. Well, clearly Mel's been stretching like crazy and it's not getting any better. I always say the definition of insanity is doing the same thing over and over and expecting a different outcome. Now, I talked about this topic in depth a couple of years ago. So what I want to include in this week's video is an older video from that where I really dive into the idea of why these hamstrings are tight, what's causing it, and how to get it fixed for good. We'll get our educational video out. I want to talk about why your hamstrings are always so tight even after you stretch them. So we're going a little more depth about what's really going on. What's happening is the nerves that are deep in your muscles, in your butt, and down through your hamstring are getting stuck, and your hamstrings are tightening up to protect that. So no amount of stretching will fix that. So people non-stop stretch their hamstrings, feels better for a little bit, but they're right back to where they start. So we want to give some education on that. So what we're looking at here is actually the sciatic nerve. This white area in here is the nerve, and then there's some muscles that are really deep into the butt, and this is peeling back the glute. So these tiny muscles in here are called your external rotators. And what happens is when we spend a lot of time sitting, which a majority of us do, it puts that nerve in a constant contraction and puts a lot of pressure there. Now the muscle and the nerve get stuck to each other. So what happens? When you sit for too long, the muscles get overworked, they don't get enough blood, and they don't get enough oxygen. When that happens, the body starts to lay down what's called adhesion. Adhesion is like glue that gets inside the muscle. And when it happens, it makes that muscle less flexible, which is bad enough. But the problem people are running into with tight hamstrings is this nerve gets stuck to the muscles deep in the butt. So it's almost as if someone's pinching you off here and that nerve is getting pulled, which presents with tight hamstrings or pain down the leg, or symptoms very similar to sciatica. So over time this builds up. So what happens is when you do a stretch on there, it temporarily allows that muscle to relax. When it relaxes, you do get this window of opportunity of improved range of motion, but it never lasts because that problem is in there. What we do in our clinic is we're experts at finding the adhesion, and we're able to get in there with our hands and actually break down all of this adhesion. What that does is it restores normal range of motion and flexibility back to the nerve, and then the hamstrings can relax so you don't have to spend all your time stretching your hamstrings. So I hope you got something out of that video. A couple take homes from the video. Number one is you got to get to a specific problem. Tight doesn't tell us anything. In order to fix a problem, you must know what it is in the first place, and being able to decipher exactly why those hamstrings are tight is the key to getting it fixed, because you can't fix a problem if you don't know what the hell it is in the first place. Number two, if it's not working, then quit doing it. People continue to do the same thing over and over again. So if you have tight hamstrings and you've been stretching for a couple weeks and it's not getting better, that is not the tool that you need to get it fixed. This is why you need to get to a Peak Method certified provider. They're the best option. Basically, they're going to start by figuring out exactly what the problem is. Because I said before, you can't fix it if you don't know what it is in the first place. then they're going to be very specific and very precise with their treatments and be able to go in there and break down that scar tissue like I talked about in the video. And lastly, the treatments are safe and they're effective and they're long lasting. You're not getting injected with all sorts of stuff that's not going to make it work. You're not exposing yourself to surgery. You're not taking pain pills, because at the end of the day, you have to get to a tissue specific problem and have someone that can actually fix that problem. And the best in the world are trained. In the Peak Method, if you want to get access to one of them, all the information is listed below, or just send us a message. We'll get you hooked up with one of those amazing practitioners from all over the country. So if you like the video, give it a comment, a like, or share. If you know anyone that this could help with, tag them, send it their way. Send us some questions. If you are having problems with this and you're trying to get to the root cause of what's going on, we always offer a no-charge injury consultation to figure out exactly what we can do to help. And we only take on those that we know we truly can help. And lastly, send in any questions that you have you might want me to cover on the Ask the Doc series. I always appreciate you guys watching, and I'll see you on the next one. Bye.